starting the timer. Once you've read the first one, please tell me and I'll change the slide.
Okay, ma'am. Can you please change?
Yes,
the slide?
sure. Yes.
Okay, ma'am.
All right, you're ready? So if you've
Yes, ma'am.
read and understood, considering it communication skills station, please begin.
Hello, good morning. I'm Dr. Sudarshan, ST1, working in Royal London Hospital, working for Dr. A. I'm calling to uh, talk with Mr. A, Dr. Consultant CTBS surgeon, cardiothoracic vascular surgeon, regarding a referral of a patient who had a accident, and in chest X-ray there is wide mediastinum. Can I confirm that I'm talking with Mr. A, CTBS surgeon?
Yes, I am Dr. Smith. I am the cardiothoracic surgeon. Yes, what you have? Can you
Uh,
summarize your case, please?
Sure, doctor. We have a 23-year-old motorcyclist who came to extend an emergency with in a drowsy condition, and he has complained of right-sided chest pain. He is also known case of diabetic. On clinical assessment, his GCS was 14 and slightly and tachycardia, BP in lower side. Hemoglobin was low with normal urea and creatinine, and CRP was minimally raised with ABG of metabolic acidosis. On examination, there was left thigh swollen, um, and we have given we have resuscitated this patient with 4 liter of crystallite solution, and we have arranged 6 unit of blood. And in a chest X-ray, there was bilateral effusion, which seems hemothorax. So we kept chest drainage tube on the right side, and 200 ml of blood was drained. Then in abdominal X-ray shows loss of Suarez shadow. And at the moment we could not perform CT because since due to service, and so we would like to refer this case for this widened chest X-ray, widened mediastinum, and for the further evaluation and management of this patient.
Okay, Doctor, can you tell me who's the name of your consultant?
Mr. A.
Okay, can you tell me
I'm working
what
for
you
Mr.
will?
A.
Okay, what you will do for cervical spine?
I will put triple on the form of triple immobilization, like cervical collar and sandbag and tape.
Okay, do you think this patient is in shock?
Because like patients is tachycardic, BP in lower side. So I'm thinking patient is in hemorrhagic shock due to bleeding.
Okay, what type of shock?
Hemorrhagic.
Only?
It could be it could be hemorrhagic shock. Sorry, hemorrhagic shock due to bleeding, and trauma due to cardiac trauma, cardiogenic shock,
Okay,
and
means you it
because
could
what
be
is
Yeah, it could be hypovolemic or cardiogenic. Okay. What will you do for the leg? You said there is a femur fracture, right?
Yes.
What you will
Yes,
do for
doctor.
this one?
I will keep homocysteine at the moment.
Okay. And what will you do for the blood pressure? You said he is tachycardia and hypotensive. What you will do?
I will resuscitate this patient with 4 liters of fluid. Then I have arranged 6 units of whole blood. If it's if it's continued, then if hemoglobin continues to drop, then I will do blood transfusion with this whole
And
blood.
why the patient is metabolic acidosis?
Mm, because patient is known case of diabetes, so it could be the diabetic ketoacidosis. The patient has femur fracture, shaft of femur fracture, so compartment syndrome, and due to hemorrhagic shock because of bleeding.
Okay. What other investigation you will do to add? You will add.
Um,
Mm.
okay. What investigations?
Mhm. Okay.
I would like to.
What?
I like to do fast ultrasound scan.
Okay. Okay. What imaging you will do for this case?
Imaging. I like to do CT of head and neck, then CT chest, CT of the whole body, including abdomen and pelvis.
Okay. What about his abdomen?
Abdomen. First, I will send for CT abdomen and pelvis. Then after that, I like to do FACS scan. After confirming like there is something, if viscous perforation, then I would like to do exploratory laparotomy.
Is there any suspicion that you have something in his abdomen?
Because
Yeah.
there is loss of psoas shadow in the abdomen.
Okay. Good. What are his blood abnormality?
Blood abnormality. ABG shows metabolic acidosis,
Mhm.
and CRP is raised, and hemoglobin has been reduced to 8.
Okay. Who will accompany the case?
I will call for my trauma unit, and along with ITU colleague and anesthesia colleague.
Okay. Why do you refer this patient?
Because patients has widened mediastinum, which might be due to
Yeah.
great basal rupture and cardiac tamponade.
Okay. What does it indicate? Cardiac tamponade and aortic rupture. Okay. What's the other differential diagnosis?
Other differential diagnosis could be the retroperitoneal rupture. Because there is
No. I ask you about the widening mediastinum. What's the other differential diagnosis?
other differential diagnoses for widened mediastinum are aortic rupture or esophageal mass
Aortic
and
dissection, cardiac
aortic
tamponade,
dissection. Yeah.
great vessel injury. Okay. What you will prepare in ambulance during transfer of this patient?
I will send this ambulance in blue lighted with well equipped CPR, well equipped instrument where we can perform CPR and intubation, mechanical intubation.
Okay.
Sorry, tracheal intubation.
If this patient need intubation on the way, who will do this?
Our consultant anesthetist will perform this intubation test.
Source of a bleeding and hemorrhagic shock in this patient.
Sorry?
Source of a bleeding and hemorrhagic shock in this patient.
Because of rupture of great vessels like aorta and pulmonary vessels.
What else?
Could be retroperitoneal vessels.
Yes, from the abdomen. What else?
abdomen.
Thigh, femur quadrant. Okay.
Sorry.
Okay. What type of shock the patient has?
Patient has
Sorry,
hemorrhagic
this we
hypovolemic shock.
answered that. We asked this one. Other cause of shock in this patient: obstructive cardiac tamponade. Okay.
Cardiogenic, yeah.
Yeah. You suspect a major vessel injury. Why chest tube drain 200 ml only? If it's a great vessel, means it should be bleed more than this 200 ml. Why?
Because great, even if there is bleeding, it is enclosed within the mediastinum cavity. So this because of peripheral vessel injury, we drawn this much.
No.
We have drawn.
No, okay, we'll
There's two in
go
the peritoneum.
what's the definitive management for the aortic injury? If aortic injury, what's the management, surgical management for this one?
I'll come back to you. Sorry.
Okay. In which part of aorta usually injury? The injury in which part?
In the
Descending part.
ascending part.
Descending part.
Okay. Descending part. If widening mediastinum due to cardiac tamponade, what's the treatment? Hello?
Yes.
Okay. Again, what other investigation you will add for the heart if you're suspecting heart trauma?
I'll send ECG and echocardiography and
Okay,
CT angio.
Okay, thank you. You can transfer your patient.
Okay, thank you.
Oh, what a difficult examiner.
Yeah.